An Introduction to Social Policy by Dr. Nick Wilmore. In this fifth part of this series, I'm going to start looking at the implementation of social policy, which is very much a field in its own right. This session is very much about the implementation of social policy and looking at some of the tensions inherent within it. Although I have separated the implementation of social policy from the discussion around social work and social policy, it's probably worth noting that actually the two do go very much together, because social work is inherently linked with how social policy is implemented. So far, what I've done is I've set out what social policy is, how it's developed, and ultimately how it's captured in terms of guidance, regulation, legislation, and so on. At that point, you might think, okay, so we've got social policy, now what? And I guess that's the bit that I'm going to focus on over the next couple of minutes, because the development of social policy is almost one field of study and the implementation is a second one. And I think the challenge for many of us working in the loosest sense, the public sector, is very much about how do we implement social policy? How do we understand what it is that is intended by central government, what it is actually, as professionals, we should be doing? And that brings us into a whole new range of literatures called the Social Policy Implementation. And I'm going to unashamedly at this stage bring forward the work of Michael Lipsky, who I found incredibly useful as a way of understanding some of the dynamics. And if you're interested in how Michael Lipsky's work might be considered in a social work context, I would very much suggest you look at the work of Tony Evans or Catherine Ellis, who in the last sort of 15 years have written several quite useful articles about actually how does the social worker try to implement legislation, how does the social work organisation try and manage those social workers delivering the policy implementation. And I think that's quite an interesting dichotomy between the two, because they're not always fully aligned. How many managers have we heard say, if only social workers would do as they're asked to do rather than what they think is a good idea? And we have seen that fairly constantly. My experience as a manager has certainly supported that. So social policy implementation is an area of study. I'm just going to briefly touch on that today, but recognise there's a lot more to it than what I'm covering. When looking at the implementation of social policy, it's just worth reflecting back to the earlier discussions that we've been having. And I noted here Hagenbuch talking about social policy is setting minimum standards and opportunities for individuals. And that comment really just shows his idea that it's almost like it's an active process, that you have to make sure you have to be providing something in order to create that minimum standard. Another element that I'm very conscious of and will be following up is Lipsky, who introduced the concept of the street level bureaucracy, where you had a large number of frontline workers who were implementing policy and making decisions concurrently. So you're having lots of these decisions at happening almost at the same time, concerning lots of different citizens. And he was recognizing that some of those decisions were being made on the basis of what is the policy. Some of those decisions were being made on the basis of what is right for that citizen. How can I get a good answer for that person within the framework in which I am working? And some of it was about actually the professional value base of the worker, indicating that they needed to work in a particular way. So it's quite a nuanced approach, but one that recognises that decision making when delivering social policy is not actually that simple and is often influenced by multiple factors right up to the moment of frontline service delivery. Lipsky, in his initial work in the 80s, was looking at the delivery of welfare support to people in the housing projects within the Washington area. So it was being based in America, but what he was understanding was that workers were interpreting policy on a day-to-day basis, and therefore the allocation of public resources, the welfare benefits that they're talking about, was being selected as much on the evidence in front of them as it was around the wider public policy intentions of the federal government. And this then potentially results in a range of unintended consequences in the policy. A lot of professional organisations would say they are aware of that, and what they're trying to do is further their ethical considerations as a professional group. Policymakers would argue you're not doing your job. So it's quite an interesting tension between policy and the implementers. And it starts bringing into the discussions that are already very well rehearsed around, are we meeting the needs of the deserving or the undeserving recipient, which is a concept that's been with us really since the days of the Tudors, where they started setting up the early parish almshouses. So Lipsky was really trying to understand the different motivations, the different incentives around this tension between the policy, the professional, and the recipient, and how professional values and ethics were brought in. And that really came in his 2010 rewrite of his initial book, where he recognised that in the intervening period, professionalism had become a much stronger motivation. It's interesting in as much as in the same period, particularly in the UK, we had the new public management coming through. So that's Hood and Dunleavy's work back in 93, 94. And from that, one of the things that they were saying is managers needed to be sceptical of professional groupings, which has seen rise of managerialism at the expense of professional discretion and the role of the professional in service delivery. So it's what it's showing is public service delivery, the delivery of social policy is not easy, and I don't think anybody has actually reached any conclusions yet as to the right way to do it, and therefore it will be a continuing matter of debate.